Good afternoon. My name is Natasha Shafer Solle, and I'm from University of Miami and the Firefighter Cancer Initiative. I'm really excited to be here today to be able to present to you about some of the work that we've been doing the last few years working with female firefighters. And so today I'm going to talk about addressing cervical cancer risk in female firefighters and looking at women's health and cancer prevention strategies. So to start off, we're going to talk a little bit about work-related health and cancer risks, some of the epi data that's out there on female firefighters, and then some of the qualitative data collection that we've collected in the last few years, which have led to some of our cancer screening programs and what our future directions are. So according to the 2018 NFPA survey of fire departments in the U.S. fire experience, women firefighters represent 8% of all 1.1 million career and volunteer firefighters in the United States. This is a 3% increase since 2015. 4% of our U.S. career firefighters are women, and 11% of our volunteer firefighters are women. And so we know that there are some concerns that are work-related for our female firefighters. And some of the literature that has published this has shown that some of these concerns include increased physical injuries and fatalities, complications related to pregnancy and fertility, high rates of depression, anxiety, PTSD, and suicide rates, and also a heightened risk for certain site-specific cancers. And that's what we're going to talk about today and where my focus is. So as far as the national epidemiological data, we see in 2014, the researchers reported that women firefighters had a higher incidence and mortality rates for breast cancer compared to the general population. And then more recently in 2020, we saw out of San Francisco that women firefighters were exposed to higher levels of some carcinogenic compounds compared to the control group of office workers, thus increasing their risk for breast cancer. When I look at a more, closer look at to where we live in Florida, we look at cancer incidence in Florida professional firefighters. So this was a study done about 15 years ago with Dr. David Lee, who's one of our lead investigators on FCI. And we see the linkage data between 1981 and 1999, where we're looking and linking the actual women or firefighters who have had cancer to our state registry. And so what we saw here, specifically with our female firefighters, is that there's a significantly increased incidence for overall cancer, cervical cancer, thyroid cancer, and Hodgkin's disease. So when I first was able to look at this data about 6 years ago, it really struck me that the cervical cancer was so high. You see a 5.24 SIR there. And so it definitely brought concern and, a reason for us to investigate more what was going on. And so with that, we started doing some formative work and doing some focus groups and some interviews with our local female firefighters in Florida. And so what we saw was that a lot of the women were reporting that there was a lack of routine screening for cervical cancer. So, receiving your pap smears and your HPV testing. And some of the reasons for this was due to their shift work and balancing their home and work life, as well as the firefighter culture. And so what we did with that information is, since we were being told that it was not a lack of resources, but more just they weren't doing the screening because of the issues of their shift work and be able to accommodate balancing both going to the doctors and taking care of themselves, as well as being a firefighter and being taking care of people at home. So that led to our first pilot project of our cancer screening program. And so this was a Worksite-based cervical cancer screening among female firefighters. So we were determining the feasibility and acceptability of this work-based or home-based cancer screening program for female firefighters. So what you can see here in the picture is a home-based test for HPV. So women would receive one of these kits either in person at a fire station, where they would complete it in the bathroom and give it back to us, or we would mail it to them at home and they would mail it back. The eligibility criteria was for them to be ages 21 through 65, with no history of a hysterectomy or cervical cancer, as well as not being updated with their pap smear in the last 3 years. And so what we saw from this information or from this study was that, we screened 247 women for eligibility. Of them, only 26 were eligible. So what we saw that even though women were reporting that they were not being screened, they actually were. They were being screened within the 3-year mark, which makes them, under the guidelines that they are following screening. But of the 26 that we sent out, 14 of them returned their kits, and we had one HPV positive. A majority of those women who were eligible also reported not having had received the HPV vaccine, so about 81% of them. Also, 60% of the women who were eligible said that they did not have screening due to a lack of time. And so, realizing that it wasn't necessarily that women weren't screening, but that we did see that a majority of them were screening, it led us to our next pilot study where we wanted to see, maybe there's something else that's putting them at risk. And so we're looking at what we looked at here was a vaginal microbiome of our Florida female firefighters. So we had a sample of 35 women where we separated them by their years of experience. You can see years from 0 to 4, 5 to 15, and then over 16 years. And so it was the same way as far as the self-sampling was done for the HPV. They were given a kit, they would self-sample themselves in the restroom, and then they would share their results with us and we would send them to the lab. So you can see here it would be a self-sampling collection, the DNA extraction and shotgun sequencing for the microbiome, and then we would receive the microbiome profile. And so what you can see here is that we have a relative abundance of all bacterial and viral genera detected. So there was a total of 21 bacteria here and 2 viruses that were detected. Mainly lactobacilli profile in many of the women. And we observe a diverse microbial profile in this study population. So that's why you see there's so many colors. It was very diverse. So really looking here at this picture, we're looking at the most abundant that were detected. And so these are the 10 most abundant bacterial species that were detected. And what you can see here is the lactobacilli, which is the lower, and anything lighter, which is that's your good bacteria. So that's the better. But then we also see the opportunistic bacteria, which is the darker one. And you can see up here, and we'll go a little more into, as far as how much we found. But this is the bacteria that is more associated with bacterial vaginosis and common in postmenopausal women, so changes in pH levels, and reproductive age women who are sexually active. And so as I show you here, these darker colors that I was mentioning, 45% of women had this lactobacilli dominated microbiome. And so that's your good, this is your good bacteria. This is what you want to see. However, even though we see that there's 45%, we would still expect a higher rate of women based on the race and ethnicity that we had in our sample. And so we usually see a much higher rate in women, in white women, usually about 80%. So, our majority of our sample here was white, and we see it at 45%. Also, with our African American and Hispanic women, we would expect to see about a 60% level, where again, we're seeing 45. And then here we see the 25% of actinobacteria, which is dominating the microbiome. And so this is, the one that we would consider opportunistic. And so that's your Gardnerella, associated with many reproductive pathogens and bacterial vaginosis, which may lead to, difficulty becoming pregnant, also may lead to risk for miscarriages and decreases for IVF success. And so this is something that's often been, discussed in the world of female firefighters and how their job may put them at risk. And so these are some of the findings we found with this one pilot. The other thing we look at here when we're looking at the different bacteria is how it changes over time. So you can see the darker colors is for the years of experience. And then, so you could see here our Gardnerella vaginalis, which is our opportunistic one. They do get higher as they get older. And you can see the lactobacillus, which is our good bacteria, is much higher in our younger or lower tenure firefighters. The other thing that we look at here is that we found pretty interesting is the difference between the Hispanic and the non-Hispanic population. And so again, we see a much higher rate of the Gardnerella vaginalis here in our Hispanic population compared to our non-Hispanic population. The other thing we look at here, we look here with our race is between white and African Americans. And unfortunately, because our sample size was not diverse enough, it really doesn't show us too much because the majority of our sample was white. But we do see a difference in relative abundance here of the Gardnerella versus the Lactobacillus. And lastly, what we wanted to show, as I mentioned, I showed you the 10 main bacteria that were detected. We also saw 2 viruses. And so although none of the 35 samples were positive for HPV 16 and 18, 14 of them were found to be positive for other HPV types. So, but they were non-specified. And so, from this pilot that we did here, we did see that there was a trend for shift in microbiome composition towards the opportunistic bacteria that we discussed. Age and ethnicity may act as confounding factors, and that only 45% of the women had lactobacillus dominated microbiome, which again, we talked about depending on your race and ethnicity, it should still be at a much higher rate in both the white and the Hispanic women that we saw a majority of our sample in. So with that, we've taken some of that information and we've created a lot of educational materials for our female firefighters, specifically on the topic of HPV and cervical cancer, but also really focusing on how HPV is important for both men and women as far as making sure we're utilizing the vaccine if you're the recommended age, and then the same thing for women. And then as far as future direction goes, we have a current project right now that we are actively enrolling female firefighters in. This is funded by NIOSH, and we're looking at cancer screening behaviors of female firefighters, again, using a home-based HPV test. So not only will we be or are we are screening for HPV and also taking samples of the microbiome. We're also taking a sample looking at pHs, so seeing if the carcinogenic exposure of the women firefighters, if that is playing a role. So we know that pHs are carcinogenic. We know that they've been seen on the skin. So we want to see if it's possible that it's entering the vaginal area of the female firefighters and if this is playing a role on their microbiome. So as I mentioned, we are currently enrolling participants. We are doing this at a national level. Kits can be mailed to you and you can mail them back to us. So if you are interested in participating, please contact me. My email is right there. And if you have any other contacts or anything or any other groups that would be interested, we'd love to share this information with them. And lastly, just, continuing with our future directions of, how we want, what we want to do next, and really evaluating our workplace exposures in relation to the microbiome and HPV status, expanding our screening program to the national sample and more diverse population of volunteers and also firefighters that are more in rural areas, and then increasing our reach of women through virtual seminars like this one and online education events. So we know due to COVID how things have been changing quite quickly. And so we are trying to take advantage of these different opportunities to be able to educate women and teach women about what's out there and how we can get them enrolled in some of these amazing screening programs. So if you guys have any questions, I'll take questions now. My contact information is there. As I mentioned, feel free to email me, call me. If you're interested in being part of our newer study or any of our other cancer screening programs, we would love to share the information with you. Thank you so much.